Okay, we are in fact recording. Emma, welcome to the podcast. Thanks for doing this.
Thank you so much for having me. It's lovely to be here.
It's my pleasure. Shout out to Adam Duncan, who gets a shout out on every episode of this podcast. Apparently, he was the guy that connected us, and so I've been really excited about this one. This one has been, and actually, it should have happened before Christmas, but I had the nursery lurgy. It flatlined me a little bit, so thanks for rearranging.
No, glad we're finally here managing to do it.
So what's cool about this one, I said this on a podcast a couple of weeks ago actually with another guest. I don't know you super well, so I'm quite excited to get to know you a little bit throughout this conversation as well, so it's going to be a learning opportunity for me. For those that also don't know you, Emma, could you give us a bit of an intro as to who you are and what you do, please?
Yeah, absolutely. So yeah, my name's Emma Stennett, and I'm a senior specialist gastroenterology dietitian, and my main job is actually at a big London hospital, and I've worked there for a few years now, but I've been in the NHS for over 10 years. Over the years, I've sort of dealt with patients with a multitude of health conditions, but my real focus is on gut health, and anything that kind of comes under that umbrella term. So everything from IBS to celiac disease to inflammatory bowel disease, so things like your Crohn's disease and colitis and things like that. But I've also historically worked with patients sort of undergoing liver transplants, so sort of supporting them through their whole journey. So that's sort of been my main focus, but over the years I've kind of done a little bit of everything. Over COVID and during sort of the peaks in COVID, I was on ICU sort of seeing the patients there. So over the years I've kind of done a little bit of everything, but I'm sort of back to my roots now with sort of more the gut health focus. Also part of my job is actually part of our pelvic floor team, and actually we're really lucky in the hospital that I work in. We have a really well established pelvic floor team. So actually I do end up supporting a lot of people that have had issues with their pelvic floor, perhaps due to things like radiotherapy, childbirth, different surgeries. So really trying to take a really holistic approach in how I sort of support my patients. But I'm doing a lot of quality improvement stuff at the moment. So I do a bit of service development, improving things for our patients overall, but still making sure that I see the patients to remember what it's all about, why we're here with the NHS.
Got it. When we first spoke, you explained to me you are a dietitian, not a nutritionist by trade. And not just you, but other professionals in your field that I've spoken to always want to make it very clear that there is a distinct difference. And in fact, would you like to perhaps just share what those differences are? Because I think that is confusing for the layman. Oh,
hugely confusing. And actually just say there is no offense in being called a nutritionist, because actually there are some fantastic nutritionists out there, but there is a difference. The phrase dietitian is a protected role, it's a protected title. So not anybody can call themselves a dietitian. You have to have an accredited degree with a very set load of training goals that you have to meet. And it's very hospital based, it's very disease related. So a lot of my training, all of my training in fact, was in hospitals. So I didn't do any industry work. I never went into any food science side of things. My training was predominantly in health and disease and how we provide advice to patients with particular health conditions. A lot of the nutrition and nutritionist training is perhaps very similar, and actually a lot of our lectures at uni were with the nutrition students as well, but they just never went into the hospital side of things. So their expertise is not necessarily in disease related nutrition, but that's where perhaps nutritionists can be really helpful at general healthy eating advice and day-to-day advice that's not disease specific, and again that's very relevant to things like gut health and a lot of the stuff that you're kind of hearing in the media at the moment. But for us as dietitians, we're really proud that we have that particular knowledge. So yes, if you call a dietitian a nutritionist, you may get a correction initially. It's not due to offense, it's more to do with the fact that we've worked really hard for that title, and we're really proud to call ourselves dietitians.
I think that was really well put, and also quite a diplomatic answer. I will go as far as the generic fitness professional and say that there is a lot, particularly on social media at the moment, there's a lot of nutritionists, and they're taking that title along with their level 3 personal training qualification, which, of course it's, I'm not saying it's easy to get, but it's not I think I'm kind of going with this. Anyone can kind of say I'm a nutritionist because I know a little bit. I mean, I help my clients with their nutrition. I am not a nutritionist. I have a base of knowledge in that field that I've accrued over years and years and years. But you're absolutely right. There is a significant difference in terms of the route to dietitian.
Yeah, absolutely. And I think what's really interesting and what we're seeing a lot in our clinics at the moment is patients that have been to, personal trainers is one example, but people that claim to be nutritional therapists. And again, you don't always know where people's qualifications are coming from. And actually there is, you can become an accredited nutritionist where you are, you've got an accredited degree from a reputable place. So there are people that have got really good qualifications and they're absolutely in the place to be giving advice. I think where a lot of our frustration is the misinformation that comes out and people saying, oh, you should follow this diet because it worked for one of my patients or it worked for me, but it doesn't mean that's going to work for everybody. And that generalization of advice, I think, is where it gets quite dangerous. And also there's a lot of stuff at the moment about blood glucose monitoring and Ozempic and all of these other, weight loss aids and things that might help you to identify your metabolic response. So I think a lot of what I'm doing in my clinic is actually myth busting and kind of unpicking what they've already been told. Sorry, I've got a dog in the background. I'm picking what everybody else has been told by other healthcare professionals. I think what's also really tricky is things like the intolerance testing that is going out these days. That's also another bit of social media that I'm really banging my head against the wall with. Just no evidence for a lot of these these hair sample testing, these blood finger prick testing kits, and there's just no evidence for them, or very poor evidence. And actually patients are changing their entire diet on the basis that they can't have oats or green peppers, and you're thinking, well, hang on, there's no evidence for one strand of hair to say that you can't have that if you don't have any other issues with it. So yeah, I think a lot of what we're doing now in the NHS is unpicking what everybody else has told our patients. And I suppose that's probably the angle I probably answer a lot of my questions from, actually, is that at the NHS, we probably get people at the one extreme of it, but there's a whole load of people that never make it into our service that are probably just as confused as everybody else. Very complicated.
I think you talk about extremes, and that's really interesting to me, because one of my biggest pet peeves at the moment is, particularly in the social media landscape, everybody seems to have a hill that they're willing to die on. I think the nuance is gone. Actually, I was having a conversation about this with Adam a couple of weeks ago. We were, we were mid-treatment, and I was kind of asking, I always ask his opinion on stuff because I think he's super knowledgeable and I value his insight. And we were talking about the language that has been lost in the social media landscape of the kind of the gray, the maybe, the possible outcomes. It's likely that if you do X, this will happen, as opposed to it's like, this is the thing, this is the only thing, and it's great for clicks and it's great for views and it's great for interaction, but it really is a mess. It's awful.
And I think what's really hard is that there's no marketing regulation with any of this, and because there's no regulation, people can just sort of make these claims, and it's a really dangerous landscape, social media, and we all know the dangers of the internet and social media. But I think these days, because there is that influencer culture, and a lot of these people that actually masquerade as doctors with their, very well accomplished as PhDs, but actually, are you a nutrition expert? And equally, you've got a lot of, there's a lot of GPs out there who are doing lots of, social media posts. And because they're a GP, people really trust it. And it doesn't mean to say that everything they're saying is wrong, but it can be really misleading when they're saying, oh, follow, you must do fasting and you must do the 5-2 diet. And you're thinking, well, that isn't relevant for everybody. And metabolically, is that the right thing for every patient?
Right.
No. So yeah, I think what you really do have to do is, and what we're actually taught to do as uni, is critically appraise everything that comes to you. Do you believe everything that is out there? And I'm having that own battle myself at the moment with things like collagen supplements. In theory, you're thinking, great, collagen would be good for my hair and my nails and my skin. But are there any studies to show that it actually is beneficial long term? Are there any dangers of it? And I really have to then look at these products and go, is this really worth the money? Sometimes the way that I kind of see it is, if it's too good to be true and they're charging you for it, it probably is too good to be true, and you're paying them a lot of money. So I would always be mindful that if someone's charging you a lot of money for it, it's probably because there's not enough evidence for it to become a treatment on the NHS and therefore making it free. Sometimes that's kind of how I explain it. If there was enough evidence for it, the NHS would be adopting it and getting it out to patients so that it was treating a problem. So again, I think having your wits about you with any advice you're given, whether it is from a PT, whether it is from a doctor, really think, where's that advice come from? Do a little bit of research around it, because if you take what you're, what you see as gospel and then don't deviate from it, that's kind of where people run into trouble, become over restrictive, and people become quite obsessed with it, sometimes in an unhealthy way. And it's good to be fixated and have a focus, I think, with diet and nutrition. But the moment that you start overthinking it and overcomplicating it is when it's gone too far. And I think that's what I always do with anyone I speak to. Bring it back to basics. Don't overthink it. If you start worrying about you can't have green peppers, that's when you know it's gone too far, So I think, if you overcomplicate it, that's where it gets a bit messy.
I think that's really well put. And I think that will help a lot of people out. And I think it's what a lot of people need to hear. The can I have this? Can I have that? Are we nitpicking too much?
Yeah.
So it's a good point. Cool. So I think it'd be really valuable just before. So I probably didn't say at the outset, although it will be in the show notes. This is Nutrition 101. So this is kind of an idiot's guide. So you're talking to the right person into nutrition, just kind of setting the I guess a bit of a basic blueprint to understand things in a little bit more. I guess a simple overview, but with maybe a little bit of detail peppered in. And then you and I talked about coming back and doing a bit of a deeper dive into the stuff that you really get your teeth into on a daily basis. With that in mind, however, would you just give us a bit of an overview of your day-to-day so we can understand what it is you're doing in your day job, please?
Yeah, absolutely. So so when I do have my patient-facing time, so my clinics, these are patients that have been referred to us by consultants and by GPs, and sometimes from other dietitians from their clinics. So what I do is I have a clinic list in a day. Most of my clinics have about 6 or 8 patients in. So when I log in, I'm then sort of looking at the patient notes, I'm looking at their history. And for us, the history is more important than anything else. We need to know what that patient journey is, what their medical background is, investigations, because for me, if the outcome of those investigations are different for every patient, that's going to change how I approach that, that patient's advice. So I really make sure that I've got all of the information that I need on my patients. I don't cover the inpatient wards at the moment, but it's exactly the same when you're covering those. You go up there and you gather all of that information that you need. So actually information gathering is, the first 10-15 minutes of seeing most patients, to be honest. And then we see our patients in clinic. We do a variety of delivery of our dietary advice. We give advice in one-to-one settings, and sometimes actually for some patient diets we do it in group sessions, which is really good fun. Actually really good to have that really good interaction from patients in a group setting, bouncing ideas off each other, sharing opinions on things. So I really enjoy kind of both elements of that. But the other half of my job is sort of lots of quality improvement projects, service development projects. I'm really big on digital transformation at the moment. I think we're in a much more digital world now, and people are much more comfortable going through apps and logging on to their healthcare record and sort of completing questionnaires and things like that. So what I've been trying to do is digitalize as much of our service as possible, and actually reduce the amount of time patients are waiting, increase the quality of advice they're getting, and the quantity as well. So making sure that we're facilitating things like group education sessions. So a lot of my time is really focused on improving the NHS service that we offer for our patients. And then off the side of that, I do get a lot of requests for private patients. And these are patients that perhaps aren't quite unwell enough to go to their GP and need to be referred through the NHS, or perhaps they have and not gotten the advice that they need through whatever team they were referred to. So actually then I see a lot of patients outside of my NHS work, and again, a lot of it tends to be gut health, but I do get a lot of requests for just general advice for weight loss, diabetes management, and actually more and more recently has been more of a request for pre and postnatal care. So just understanding what your body needs sort of during pregnancy, after pregnancy, recovery, and all of that. So yeah, my day-to-day job can really vary depending on whether I've got clinic, whether I've got meetings, supporting staff members. But yeah, there's no 2 days that are the same unless you're just sort of doing clinic on repeat. But you generally pretty varied day-to-day job for me.
Love it. Thank you for the insight. So let's get into Nutrition 101. I think the big thing that most people will be hearing, and I'm going to refer to social media quite a lot because I think that's where we get most of our information now.
Yeah.
I think the big word that we hear all the time is macros.
Mm-hmm.
So would you be kind enough just to give us a bit of a slow walk through into macros? What are they, and what sets them apart? And then perhaps we could do a bit of a quick deep dive into each as to their function.
For sure. And I find the term macros really interesting. Never in my career have I ever referred to it as macros. And I think that's something, again, that shows the difference between somebody that works in healthcare and in that NHS world versus somebody that perhaps has had a slightly different route into nutrition. I never refer to macros. And I think that, again, is a really interesting point of this conversation, because I've really had to think, hang on, what do other people understand about it so that I know how to explain it? So macros is short for macronutrients, and they are sort of the three main things in our diet that make up the bulk of what we eat. So the first one is your carbohydrates, the second one is your fats, and the third one is your protein. So they're sort of the three main things that are the components in our diet. Your carbohydrates, they provide you your energy. They really kind of provide you all of your body's cells with the energy that they need to function. So right down on a really molecular level, the smallest components in our body need sugar to function. And your brain, the only source of nutrition your brain can actually use is sugar. So regardless of whether you're carb free or high carb diet or just eat normally, your body will always convert whatever it can into sugar to feed your brain. So ultimately, it's the ultimate fuel for your body. Your liver's the battery to your body, essentially. Your liver actually stores up a lot of the sugar that you need in there, so it can then release it during times when you're not eating. So for most of us in this time, perhaps it's been a couple of hours since your breakfast, a couple of hours to go to your lunch, that's when your liver will go, cool, I've got a bit of a backup here, and I'll release a little bit of sugar just to kind of feed those cells. And then when you then eat again, it then tops up the liver and kind of keeps it fueled, ready for those perhaps prolonged times when you're not eating, such as overnight. Your liver then fuels your body overnight when you're not eating. So carbohydrates are probably one of the most essential ones, I would say, from an energy perspective, but also they provide you with a lot of fiber. And I think that's where people can kind of really demonize carbs, is that you think, oh, it's just sugar, sugar's bad for you, sugar makes you gain weight. But by cutting out carbohydrates, you're cutting out fiber, you're cutting out all the nutrients that kind of come with that. And there's a lot of our carbohydrates that are fortified with nutrients. So when you're thinking about your breads, all of the bread flour that you can buy that is then made into bread in our supermarkets is fortified with things like folic acid. And actually, for a lot of our population that perhaps are living in poverty and they're quite reliant on those low pricing products, that perhaps is the only way they do get folate into their diet. So I think it's really easy to demonize carbs, and actually they mean so much to so many different people, depending on what your budget is, what your priorities are, and also what your health needs are. So never demonize carbs. I think carbs are wonderful, but it's just the balance of how much you need in your diet as to, I think, what makes sense for you. The next thing is fat. And fat, again, really important. Very easy to demonize fat. I think there's a lot of association with things like heart disease and diabetes risk, but you still need fat in your diet to function. Very similar to what I was saying about your sugar. Your fats are actually really essential for just how your cells are made, and the integrity of your cells on a really molecular level. So fats help absorb vitamins, they help to protect your organs, they help with growth, with hormones, with reproduction function, with your immune system, and actually they can really help start off pathways that help with your metabolism and your ultimate cell function. So fats are really important, but again, there's different types of fats. There's your saturated fats, which we know are the ones that are more likely and more associated with increased risk of heart disease and cardiac events. But also you've got your unsaturated fats, your olive oils, and all of your healthy fats that are in your nuts and your avocados and things like that. So I think it's one of these things where it's not just fat or no fat, it's which fat, how much fat. And actually, you still need that. All of your vitamins, things like your vitamin D, your vitamin E, vitamin A, they only get absorbed into your body if you've got fat in the diet to absorb them with. So again, it's about balance with fat. So again, always say, don't demonize fat. Just make sure that you're being quite, objective with how much you're trying to get into your diet. And then the last one's protein. I feel like protein's the one that everyone really focuses on because it's really all about muscle gains and all of that. And I think from a gym perspective, that's what everybody's focus is, and that's what everybody tells you to have more of. And protein is great. You absolutely need it in your diet. It's everything to do with your body's tissue and repair, not just muscle. Every cell in your body needs to have protein in it to function. So, it contributes to most of your cellular functions. And again, it makes up a lot of things like hormones and neurotransmitters and, really integral in all of your pathways. So it's not just about your muscle mass. It's about everything on a really molecular level. And if you think all of your organs are made of protein, every single organ you have is a protein of sorts. So again, those kind of tissues need repairing. So it's about having those really good quality proteins in your diet and getting it from a variety of sources, because again, protein can potentially be detrimental to your health if you're only having processed red meat and fatty meats versus a lean chicken breast or a piece of fish with lots of omegas in. Not all protein is made equally. So again, all three of those macros are totally important in your diet. And I think what people get too bogged down with is how many grams of this do I need? There are places where it is really appropriate to be getting in exact grams of things, and perhaps bodybuilders, that's a whole different kettle of fish when it comes to managing nutrition, and actually that can become very, very unhealthy. But you know, there are some people that really do need to hit their protein goals, and perhaps elite athletes and people that are very focused on particular sporting outcomes do have more of a focus on, you know, targets for things like protein. For most people, it's probably about 1 gram to 1.5 grams per kilogram of body weight per day is roughly what you need. Your body can't really process more than 2 grams per kilo of your body weight a day. So say as a 60 kilogram woman, I probably need about 60 grams of protein in my diet. Anything over 120 grams at 2 grams per kilo, my body's not really going to be able to do much with. And then I'll just end up weeing it out. All the extra sort of amino acids, they get broken down. So again, I try and make sure that patients are just eating regular protein rather than just focusing on exact grams. It's more about getting all of these things in at every meal time so that you'll know you're meeting your macro requirements. I feel like I could go on forever about all of these individually, but hopefully that just kind of gives a bit of an overview as to kind of those three main categories. They're sort of the main three really that we're looking at.
Yeah, that was a great breakdown. It's really interesting to hear you talk about certainly with fats. You know, don't be scared of fats, but of course, that really does depend on the type of fat you're consuming, and how that's coming into your body. Really interesting. Also, I'd heard something I was keen to ask you. So you deal in kilograms, I deal in pounds when it comes to protein, but same. I heard something recently that the traditional 1 gram of protein per pound of body weight, so the 2 grams per kilo.
Yeah.
Right. People saying actually as low as 0.5, half a gram per pound. So again, a pound per kilo.
Yeah.
But that's really kind of shifted kind of my view on it. I've been doing this for a long time, way back when I was even trying to bodybuild.
Yeah.
Not that I was very good at it. I'm not built to be a bodybuilder, but that must get 1 gram of protein per pound of body weight. But actually half is more than ample, not just for building muscle mass, but also just for general well-being. So do you think that's kind of an old bodybuilding myth then? Do you think that's where it's come from? Because I think that the fitness industry, a lot of the fitness industry is still kind of built on the foundations that bodybuilding kind of that for me seemed to be where the fitness industry really popped off. You had like maybe in the 80s you kind of had like aerobics in the Lycra and Mr. Motivator dancing around, and then on the other extreme there was like Flex magazine and the big bodybuilders, and I feel like all of the information that we've kind of got, I mean I've got it behind me, the encyclopedia from Arnold Schwarzenegger,
the Bible.
And I think that seems to, again, I think that the fitness industry is still kind of built upon those foundations.
Yeah,
so
everything
does it need a bit of an update?
Everything in the fitness industry is about gains. It's about muscle, because realistically, you need the strength to get your outcomes. It totally depends what your outcomes are. What do you want to get out of this? And for a lot of people, they are never going to really go anywhere near the bodybuilding end of the spectrum, and actually most of the population don't. It's a very interesting corner of sports, I think. And actually I've got a couple of friends of my friend who did bodybuilding for years, and they, now that they're not doing it, said it was so unhealthy. I was so fixated on what I was eating, and everything was about the protein, and I couldn't even have like seasoning on my food, and it just there are so many extremes, and I think it's really hard to comment on that bodybuilding industry because that is not applicable to everybody. I think for most people, when you're working out and you're trying to gain some muscle, aiming for about 1 gram per kilo, and the kilo is what NHS, we work in kilos in the NHS for some reason, despite nobody else in any of the UK doing it. But I think trying to get protein in at every meal isn't an unreasonable suggestion. Not always possible for everybody. But if you are trying to gain muscle mass, then yeah, aiming for a decent protein portion every meal, and depending on how big you are, because again, if you are a 110 kilo man versus a 70 kilo man, your body is potentially very different in terms of its requirements. So I take recommendations like that with a pinch of salt, because if you're never going to be trying to do weightlifting competitions, then what's the point in fixating on your grams for protein? And also, if you've got other things going on, if you're very stressed, if you don't have the capacity to do it, then focusing on grams of protein is just the least of your worries. So I think, again, that's where, as dietitians, it's all about the individual. General advice is just not appropriate for everybody, because everybody's got their own needs. But yeah, a lot of these things are myths. And equally, there are people that do gain muscle mass by having less than 1 gram of protein per kilo. Everybody's body works really differently. And ultimately, the more you have, if your body can't use it, it just ends up being expensive if you end up spending a lot of money on these supplements. Same with a lot of vitamin supplements. If your body doesn't need it, you'll just go straight out and be expensive urine. So again, if it sounds like it's too good to be true and you're paying a lot of money for it, do you really need it? Again, it's about working with the people that know about it to get some really good quality advice on it. But yeah, protein shakes and protein, it's a bit of a sticky one. I'm doing a lot of myths about that as well. And actually, because of the area that I work in gastro and gut health, we know that a lot of protein shakes and protein powders contain a lot of fermentable carbohydrates and fermentable sugars. So everybody's going, oh, I'm trying to be really healthy. I'm going to the gym, but I'm really bloated. Why is my gut health suffering? I'm like, we're just adding in lots of fermentable sugars and you're very gassy and bloated and farting and, these looser stools. So actually, I get that in my NHS clinic a lot, because people are trying to be really healthy. And by trying to be healthy, they add foods in that then perhaps cause other problems. So yeah, it's a very complex world, and I think it's very interesting, and I do enjoy picking it apart for people and trying to work out what it is that they really need and what their priorities should be.
Well, I'm so pleased there's people like you picking it apart, because and I'm sure you've heard this a bunch. I've heard this a ton of times, whether it's working with clients or just friends or family just asking advice, and they'll say, is this particular food group, whatever it might be, pasta or it doesn't matter, but is this healthy? And I hate that term, and it's not their fault. I understand what they're asking, but well,
and also define healthy. I just think health means so many different things to so many different people, because for some people, healthy is being able to run the marathon. For some people, healthy is being able to get out of bed and go to the shops at the end of the road and not feel exhausted. Health means different things to different people, and it really depends on what your personal priorities are. So yeah, I think health. I always ask patients, what's important to you here? What's the most important thing here to try and fix or help or support you with? Because for some people, going to the gym is so far down the road that actually today we just need to fix getting you breakfast in, for example. So yeah, I think it's finding out what people's priorities are before you start giving advice. That really helps you to kind of work out where to go with those kind of conversations. I mean, you can only imagine how many times I get texts from friends, and actually even other dietitians, even people that are qualified but not necessarily in gut health. I get a lot of messages from other colleagues going, can I just run this past you? What do you think of this supplement? And I think it's good to be curious, and I'd always rather someone come to me and ask me and actually have a good conversation about it, and then perhaps we do a bit of a Google, look up the evidence for that product. That's the kind of stuff that I think is really helpful, giving people the information so that they can then make an educated decision on these products, because otherwise there are so many out there and it's so hard to know where to start. It's a weird world we're living in.
Well, it's crazy to think if you're having to go and do research with your background and your knowledge and your education, if you're having to say, hang on, let me just go and for people that aren't doing it's such a minefield, and it's so difficult.
Hugely. And so we call it CPD. I don't know if everybody calls it CPD, our continued professional development. That's very much a part of us being registered as dietitians, and we can be audited every couple of years to make sure that we are keeping up with our development. And what we do as part of our team meetings is we read journals, we look at the recently published data on different health conditions, and we have done it on on things like blood glucose monitoring, on different supplements, and looking at the evidence for those kind of things in practice. So yeah, and we take that very seriously. We are evidence-based practitioners. There's no point me giving advice out if there's no evidence for it.
Right.
And again, it helps me to kind of speak with patients and go, actually, there isn't any evidence for it, but there's no evidence to say it will harm you, so therefore it's not unreasonable to try, but I can't recommend beyond that. So I think that you have to be quite pragmatic with it. It's not a black and white, yeah, try it or don't, because not everything works for everybody. And I think that's also what's quite hard with nutrition. Just because your diet works for you doesn't mean it works for everybody else. What might work for me might not work for the next person I speak to. And it's you do really have to listen to the person and what's going on with them, because it isn't. If it was as simple as just giving out a diet sheet, I'd be out of a job. There's a reason that there's so many dietitians needed, is that everybody needs to individualize their advice. Otherwise, I could hand out a diet sheet and then hand in my resignation. It just,
100%.
we just wouldn't have purpose. So yeah,
copy paste.
Yeah. So that, again, that's why understanding where you've come from, what your priorities are, what your body type is, what your family history is. Have you got a family history of heart disease and you're at higher risk of certain conditions? What's your ethnicity? Certain ethnicities are more prone to be to having certain diseases, particularly things like cardiac disease and diabetes. Your body type, and I don't know, and again, this might be something that some people are familiar with. You can get different body types. You've got your ectomorph and your endomorphs, and where you carry your weight can potentially dictate what you're going to respond to. So if you carry your weight around your middle, around your abdomen, versus carrying it around your hips and your breasts and your upper body, that can dictate how your body might respond to certain things. So again, it's blanket advice is just not always that relevant. So yeah, honestly, and again, I could talk about just those bits all day. Everybody is different. So sometimes it is a bit of trial and error. We go with the stuff that's got the most evidence for, and then perhaps we move through the ranks after that and go, right, let's try this. We've not tried this before. Being quite pragmatic with it and quite holistic with it is very much how I approach my patients.
It makes a lot of sense. Carbohydrates. We should be cutting carbs, avoiding carbs, eating carbs. And I guess the big question I wanted to ask you is, are all carbohydrates born equal?
Well, no is ultimately the answer. That's an easy one, but there's so much more to it than that. And
Go for it.
I think we're victims of manufacturing, I think, as a population. If you think about everything that's happened over the years in terms of food science and food manufacturing, there's been incredible advances. And even just things like the canning process, the difference that made to just food security, worldwide is incredible. So, but as a result of that, we've then had loads of stuff, preservatives, emulsifiers, all that kind of stuff that's kind of come in, and that's changed the landscape of food in general, but particularly carbohydrates as well. Carbohydrates is a really funny one, and I think there's probably three main categories. You've got your simple carbohydrates, so your sugars on a really basic level, sort of when we're thinking about fructose, glucose, sucrose, the sugars in their basic form, in their absolute molecular form. So those are the kind of things that you would find in things like sugar, syrup, and also that is contained in fruit products as well. Also, you've got things like milk that's got lactose in, that's got a form of sugar in as well. It doesn't mean they're bad sugars, but any of these sugars, if you consume them in a large volume without the rest of your diet being balanced, then that's when they can potentially become a problem. And also, if you've got conditions like diabetes, where you do have insulin resistance, where your body doesn't respond to insulin helping to regulate the blood sugars, then too many of those simple carbohydrates can absolutely cause damage. But for most people, if you have sugar in your diet and you do perhaps, have a handful of sweets, you open that packet of Haribos and you sit there and eat Haribos, then yeah, your pancreas will kick into action, and then it will then help to regulate those blood sugars. But again, it's those people that have those health problems where those simple carbohydrates can become problems. We've then got our complex carbohydrates, and that's things like the whole grains and the more starchy foods. Complex, I think labeling them as a complex carbohydrate makes them sound more sophisticated than they are. It's actually, the idea of them being complex is that they're not simply absorbed in the gut. They've got a bit more integrity to them from a structural perspective. And then that is what ends up making them harder to digest even, and then slower absorption into the bloodstream. So that's what makes them more complex. And I think that name, is what people get a bit worried about. There's nothing complex about them. They're just a little bit more resistant to digestion. Right. That is kind of where a lot of your fiber comes in as well. So things like your beans and your lentils and your legumes, they've actually got a lot of complex carbohydrate in them, so despite them sort of being in the fruit and veg category as well. And again, that is where there's a big overlap with carbohydrates, is that most of your fruits and vegetables, pretty much all of your fruits and vegetables have sugar in. So again, it's really easy to demonize carbohydrates, but if you're eating fruit and vegetables, you're having carbohydrates. So sometimes I have to unpick everybody's attitude towards sugar and be like, well, you are having them. It's just not in the quantity that you're not having a bag of Haribos, and that's why you don't think it's relevant. So I think that's very interesting that people always forget that it has, fruits and vegetables have sugar in. When it comes to the third category, that is fiber. So fiber is a form of carbohydrate. And there isn't really a universal definition of fiber. It's a bit of a tricky one, really. It's kind of, the way that we kind of describe it is carbohydrates that are a little bit resistant to digestion, that remain quite whole in the gut. And fiber is then what helps to form and bulk out your stools and your poo. So someone can be told to have a low fiber diet, high fiber diet, but again, if it's not the right type of fiber for you and what your gut needs, then that can affect how your stools can respond. So for some people, they need brown bread, they need oats, they need lots of nuts and seeds, because that's what their bowel needs. Some people can have white bread, white carbs, and all of that, and still have very normal stools. And actually, the whole grains might constipate them. So again, it's not the same for everybody, and your gut will respond really differently, and as will your metabolism will respond differently to carbs. So not all carbs are born equal. I think how they're processed makes them very unequal as well. I would say, again, don't overthink it, because that when you start overthinking it, that's where it gets a bit messy. And ultimately, you need carbs in your diet, and you need it for fiber. But if you start having loads of high sugar foods, that's where I would say there is always that sort of warning to say don't overdo it. Does that make sense?
Yeah, that was really good. That was really good. Could you then talk to the term refined carbs? That's the big sexy social media term at the moment. I hear a lot of. I'm a big fan, and again, it's a complete trust thing. Like, I'm told she's brilliant, and therefore I believe she's brilliant. But Rhonda Patrick, I like Rhonda Patrick. I think she's super smart, and I think she explains stuff really well. She keeps talking about refined carbs and the effect on things like your cognitive function. So could you just, I guess for me and for everybody else, just kind of give us your thought on what constitutes a refined carb?
Yeah, so some people actually refer to it as sort of the bad carbohydrates. And I suppose this is kind of, again, this is where the terminology can get a bit more confusing, because things like complex carb, refined carbs are perhaps more processed. They've had a lot of their whole grains removed. They've become white flour and white rice, and they've had that carb, that fiber, high fiber element removed from them. And then quite often those kind of products end up being things like cakes, biscuits, pizza, pasta, pastries, all that kind of stuff. So I suppose they're refined in that they've had something removed from them, but sometimes the thing that's removed is the high fiber element of them. They still have fiber in them. It's just that they've been more processed.
Would it be fair? Sorry to jump in, Emma, just while it's on my mind. Would it be fair to say then, based on that definition, they've somewhat had the quality removed, the quality element removed, and then it becomes closer to a junk food?
Yeah, for some, absolutely, but I don't think I class pasta as a junk food.
Good call, yeah.
And I think that's where it's very easy, like I say, it's so easy to demonize a lot of these foods, but actually it just means that they're taking the bran element away from it. It's a particular component of that grain that they've removed. And it doesn't, not everybody needs whole grain and whole bran all the time. Not everybody's gut needs it. It's certainly things like refined sugars and all of these things that have had the bran removed are certainly a product of this, modern manufacturing that, we see every day. And I suppose then these refined foods become these processed foods. It doesn't mean they're bad for you. And again, if you're having pizza once in a week or once in a month, that's not necessarily going to be bad for you. But if you're having that pizza every day, is it the refined sugar you're worried about, or is it the fact that you're having pizza every day and not having any of the other foods that you need? So again, I think that's where it's a case of everybody's allowed these things. Our phrase is everything in moderation. That's very much almost like the dietitian name that, like we should all have stickers that say everything in moderation. Right. That's very much how we work, because It doesn't mean you can't have refined sugars. And again, that's not a term, that's not terminology that we actually use in the NHS, in healthcare, in our dietetic practice. I think a lot of these phrases have come from social media and almost fear mongering. It's a very media term. And actually, I think it's so easy to overcomplicate it, because pastry technically counts as being, you know, a product that's been made with refined food. But you don't see the French complaining that they're all having their croissants, you know, that's a very normal part of life. I just think that it's so easy to demonize all of these foods, and it's just not the case. And you need a lot of these foods in your diet, and not everybody has whole grain foods every day. And it's not always necessary to. It's good to have a variety of things that have got whole grains and not whole grains. And again, take these definitions with a pinch of salt. Quite often they're not always official medical terminology. Sometimes they are media terminologies. But it's a good question. And I think, again, you can see how there's so much confusion as to what you should and shouldn't be eating.
Absolutely.
But the more you overthink these terminologies and these phrases and these descriptions of foods, that, again, it gets more complicated. I think you've already overcomplicated it by trying to define it even more. I think a lot of the advice I give with carbohydrates is have it in normal portions. And again, look at packaging. I think people forget that the packaging is really helpful at guiding you as to what a portion is. You know, that's 75 grams of rice. And for some people, that might be a huge portion. Of some people, you go, oh, actually, yes, I have been overeating. So I think actually looking at the packaging of a lot of these foods, how much of this particular carbohydrate should I be having? Because technically, a portion of pizza is 2 to 3 slices. Most people eat a whole pizza.
I ate a large pizza on Saturday.
Yeah. And it doesn't mean that's bad for you. It just means that if you're doing a large pizza 3 or 4 days of the week, and then you're then not eating your proteins, your fibers, your fruits and vegetables, and because you're only having pizza, then that's the problem. It's all in moderation, you know. And I actually had a patient say something really, it was quite sweet in a way. I was talking to them about oats and the benefits of oats in the diet, because again, oats are another form of carbohydrate, really good form of fiber. And he was only having his porridge a couple of days a week and then skipping breakfast. So I said, right, let's get more oats in the diet now. And really sort of talking him through some ideas. And he said to me, oh, but when I'm at work and there's biscuits, I always go for the hobnob. So I do get my oats in. And I'm thinking, you know, it's that balance of, you're not wrong, but I wouldn't count a hobnob necessarily towards, you know, it helps absolutely if the rest of your diet is good. It then helps on top of that. But I'm not sure we can class hobnobs as your good source of oats that helps with your balanced diet. So again, it's you really do have to manage the perspective. Yeah. I get some real crackers from patients. It's very lovely. But sometimes it is about, I say calling people out, that sounds like a bit mean, but sometimes it is almost holding up that mirror to people and going, you've just said this. Can we just talk about how that doesn't quite make sense? It's like ordering a Big Mac meal and then having a Diet Coke because you want to watch your waist. It's that kind of concept for me. So I think that's where again, taking that history, what are you doing the rest of the week? Because if you're worried about that pizza you had on Saturday night, but you've eaten really well the rest of the week, then it's not a problem. Everything in moderation. I still have takeaways. I still have sweets, but I have them every so often. You know, I had a couple of chocolate hobnobs yesterday, so I thought I fancied it, but I hadn't had one for about 2 weeks before that. Right. It's about balance. You are allowed to eat these foods. And I think if you start having these blanket bans in your diet for whole food groups being removed, that is not normal. That is not what your body needs. Your body needs a mixture of all of these foods together, in combination, in moderation. And I think that's what's so hard for me. It's so simple, but I appreciate it isn't so simple for everybody else, because there's so much information out there to get confused with.
There is, and actually I've had the same conversation with 2 separate clients this week, asking them, they're new clients. They've joined with me in January for my coaching services. One is a jiu-jitsu practitioner like me, so high demand on the body. The other one is a new dad and just wants to kind of feel a bit better, look a bit better, and just feel function a bit better. And I asked them both, because they sent me their checking forms, looked at their diet, everything was really good. I just said to them, have you had a takeaway or a cheat meal? Have you got one planned for this weekend? And they said, oh, no, we're going to stick to it. I'm like, okay, well, don't forget to factor that in, because otherwise, what's the point? What are we doing if we're not having some fun with it?
Oh, I know. And I actually say that to patients when they've And it's really tricky. Everyone goes on these really restrictive diets because they're so desperate to feel better, and they're so desperate to get this right. And again, a lot of my patients have got bowel symptoms. So again, they've got a real focus there to get their bowel symptoms better. And they've cut all these foods out, and I've gone, has it helped? And they've gone, no. I went, why are we doing it then? Let's get these foods back in. Let's get the enjoyment back in. You're already struggling with these symptoms. What's the point in continuing to make yourself miserable by removing the foods that you enjoy? And yeah, I think a really good example of somebody just going, no, I'm not going to have that takeaway. And it's like, okay, if you can control it and modify all of those lifestyle factors, then that one takeaway is okay. For some people, it could just be a couple of hobnobs. That could just be their cheat thing. It doesn't mean you have to have a full-on takeaway or a whole pizza if you don't want to. But no, I'm totally with you there. You can't do this immaculate eating all the time. It's not normal. It's not how we function. And actually enjoyment and getting those endorphins and even the social element, going out for dinner, seeing your friends, you get a lot more from that hormonally than you would do sat at home being satisfied that you've eaten your meal plan that day. I think for me, it's a balance of, you've got to live your life, you've got to do normal things. And I think, the 80-20 rule, and I think that's something we're perhaps going to talk about a little bit later, but that 80-20 rule, I think sometimes is a really handy rule to go by. Let's get this right 5 or 6 days of the week. So on the one day that I know it's not going to go well, it doesn't matter. I've put in the work up until now. And that's the same with whether you've got bowel symptoms, whether you've got fatigue issues, whether you've got particular goals at the gym you're trying to meet, you may be training for a marathon, it's that balance of what's important to you and what you're trying to get out of it. And actually, if you're going to have the enjoyment of going out and seeing your friends or, getting that takeaway in, that's okay. Life's more than just food, I think. I think it's a very important part of our lives, but the more bogged down you get with it, the more you lose perspective of the bigger things as well. Says a dietitian who talks about food all day, every day, and I appreciate the hypocrisy in that.
No, I think it's valuable because again, it's deeper than just food. It's the social element. It's the pleasure element. And so my wife is also a fitness coach, and we have a blanket rule with clients that if you're going on holiday, we don't want to hear from you. Look, if you want to go and use the gym and you want to shoot me a text because there's 2 kettlebells and some resistance bands and you need some help, shoot me a text. But don't send me a check-in. I don't care how many steps you did. I don't care how many times you worked out. I certainly don't want you to stick to your diet. If you're going all inclusive and you're sticking to your diet, then I don't know if we can be friends, because there's something wrong with you. Just go and enjoy it. But there's a blanket rule. If you go on a holiday, I don't want to hear from you till you're back. Then, if you come back super heavy and super bloated, we'll work it out from there. But you've got to have that downtime too.
Hugely. And actually, one of the diets that we put patients on for managing IBS is something called the low FODMAP diet. And it's something that, only really should be done under the support of a dietitian, because it is quite complex. You're cutting out a lot of different foods. It's a really well-structured elimination diet. And patients are going, oh my God, I've got a wedding that weekend, and then I'm away with work, and what do I do? And you're like, right, well, let's do it so that the time that you are at home and you've got complete control over it, follow it to a T, be really good. And then when you're out, make sensible decisions. And these are the kind of things that you can try and avoid and be sensible with. It doesn't mean you can't go to these things. It just means you can have to make some adaptations. And that kind of advice, I think, should translate beyond anything, any kind of diet that you're trying to follow, any time. And even then, that phrase diet, I don't know it. I think the more you focus on it being a dietary change, that's also where I think people fall down. I've got patients who, and this is all very anecdotal evidence, there's no sort of necessarily any studies on this, but anecdotally, I've got patients that have been trying to lose weight for years. And, and actually there are some people I've genuinely seen with 2 or 3 years in between them for different reasons. And they've gone, oh, I'm still on that diet. And I'm like, it's not working. But then they've said, oh, I've actually left my husband because I was in an abusive relationship and now I'm losing weight again. And I'm like, well, you're not stressed anymore. And actually the stress impact can have an impact on whether your body can actually allow you to lose weight. Stressful jobs. And I'm sure, again, you've probably seen this in a lot of work you do. If you're stressed in that job, if you move jobs, you probably feel a lot better and you look better, you're losing weight, you're exercising more. Yep. I can't underestimate and I underemphasize the importance of acknowledging stress with anything in your body. The way that your body shows you it's stressed is things like your skin, your energy levels, your bowels, your bloating. If you're stressed, all of those things are probably more likely to be worse. And I've seen that time and time again. And actually, I've had patients that have gone through every diet under the sun. They've literally gone through different Pinterest things. They've gone to social media things. They've gone to private dietitians, ended up with us. And we've gone, look, you really have done everything. There's actually a really good app that does gut-targeted hypnotherapy. And it wasn't until that particular patient had done gut-targeted hypnotherapy to get more in tune with that gut-brain interaction that her symptoms started to resolve. And she had done diets for years. And it wasn't until she got in tune with that gut-brain interaction that it made sense. So
what's the app called, Emma?
It's called Nerva, Nerva. And it's something that we do recommend a lot at the moment. And and again, I think with anything that is, and I will always come at this from a gastroenterology perspective and a gastro-dietitian perspective, but your gut is like a second brain. And if you don't put the right things into your gut can't then do all of its normal jobs. And if you put the wrong things into your gut, everything kind of shows, your bowels and how your bloating is, and whether you've got good poos, bad poos, skin. There's also stuff these days coming out about your immune function and your gut brain interaction and all of that. And actually your gut bacteria can directly affect your immune function, can also be a direct effect on things like depression, your mental health, all that kind of stuff. So yeah, the more we kind of learn about our gut health and all of that makes you think, right, we should be having really good quality food going into our diet. Good quality carbs, a mixture of, complex carbs, simple sugars is fine, but good quality food, I think, is the thing that really makes the difference to all of this. And I think that's that's probably more of the focus of my advice in general at the moment is get your gut health right. It will help everything else.
So rolling on from that, do you believe there to be a link between what you're consuming and your overall performance, whether that be your work performance professionally, physically, cognitively? I wrote down a question to ask you today about the afternoon slump, which again I took some information from Dr. Rhonda Patrick again, talking about what you consume at lunch will link to your performance, so that everybody tends to get that kind of slump. And just to balance that, and I don't know what your thoughts are on this, but for about a year and a half, I went on to, I don't like the term carnivore diet because it wasn't. I just ate predominantly red meat, lots of fruits, lots of nuts. Now, for someone that suffered with IBS and lactose intolerance, that worked really well for me. The big thing I noticed was my energy levels were excellent. But I think, again, I wasn't eating kind of heavy, possibly refined carbs at lunch. But again, this is anecdotal. This is just, it made me feel great. And that it kind of all overlaps with that keto element as well, doesn't it? And ketos and fasting, and there's a lot to unpick there, and I might have to answer it and respond to it in a few different parts. I suppose in terms of the initial question being, does what you eat affect your performance? Absolutely. But I think there is more to it than that, because you can have a really good lunch, but if you've not slept that night because you've had a toddler waking you up 3 or 4 times, if you've got, bereavements, house moves, promotion at work potential, redundancy threats, that is going to be a thing that completely clouds everything. So I kind of think that you can eat a perfect diet, but if there's something else going on, that's the thing that's going to affect it. So again, holding that mirror up and going, right, what's actually going on here? Why is it that I'm having an afternoon slump? I've had a really good lunch. Is it that you actually haven't left the office and you've sat at your desk eating your lunch? Have you had some fresh air? Have you had sunlight? Have you gotten off the computer? So I think there's actually more to it than that. And I don't think it's a categorical yes or no, because there are some days my energy levels are great. And there are other days where I go, I could nap all day. And again, any female clients, where are you at in your cycle? Are you perimenopausal? Are you pregnant? Are you breastfeeding? There's so many different things that affect women hormonally, and equally similar for men. Where are you at? What's been going on? Are you exercising more? Are you taking any supplements? So I think afternoon slump's a really interesting one. I would always say that you need your balance of your carbs, your protein, and your fruits and vegetables. And I would say that about any meal, because you do need all of those components for your body to be able to fuel, to restock that liver, give your, the good fats and all of that. And also for fiber, helping form good bowel movements. Because again, if you're constipated, that can affect your energy levels.
if you have got diarrhea, that will affect your energy levels as well. You feel very drained. So I do think there's more to it than that. And I think just focusing just on that meal and whether it's going to affect you the rest of your day, I think it's quite short-sighted to think it's all about the food. I think personally, you've got to really look at everything. If all your ducks are in a row and actually you're like, I'm not stressed, things are pretty good, slept really well, exercising well, then yeah, maybe you can be a little bit more critical of the diet. So I personally am a little bit more, what else is going on with you? Reiterating my point earlier of it's not all about diet. There's so much more to us. We're so much more complex than what we eat. It is a big element, but we're so much more than that. Stress can dominate everything over it. You can have the most perfect diet. If stress is there, that will affect it.
That's really interesting. And I said earlier that Adam Duncan gets a shout out on every podcast. He's coming back in, I think, 2 weeks. We're going to do one on how stress manifests itself physically, which I'm super excited about. So I'm sure a lot of this will come up then. But I absolutely agree. You know, when I first transitioned out of my, I guess, traditional corporate job to come back into the fitness space and do this, the thing that got me doing it was the fact that I was sitting down with senior level execs in massive organizations. And these people are super successful. They're earning loads of money. On paper, they've kind of got it made, but they look like shit. And it was one, again, I won't mention his name. I won't even mention what he does because my former network will probably be able to work it out. But there was one guy, big player. And we got chatting and he just made a passing comment. He was just being a bit sarcastic. He sort of said, I'm too old for this shit. And I said, how old are you? And a hand on heart, I thought he was going to say 60 something. He was like 42.
Yeah.
Or mid 40s. And I was like, oh no, you are flying from destination to destination. You're all over the map in terms of time zones and you're clearly eating horribly.
Yeah.
And it was that conversation when I came home and sort of said to the missus, like, I think I want to do this. I think I want to help busy professionals. And that's kind of where it started because he wasn't getting up from his desk and getting out and moving. He was at a screen all day. He probably wasn't exercising because he didn't have an awful lot of time. He was definitely eating shit. So you're absolutely right. It is all of these factors rolled into one. And I get a lot of stick from people regarding my morning routine.
Right.
And it's a pretty simple morning routine. I kind of wake up, I have a cuddle with my son, I get cold, and I know there's all this stuff about it's cold. It makes me feel good, makes me feel energetic. I like it. I eat a high protein breakfast. I hydrate before my coffee. It's just these kind of basic things that make me, I get sunlight as soon as I can, or bright light if it's not. And people say, oh, well, that's, it's a lot in the morning. But I do believe that, again, it's just these little things that you can make small changes. Nothing significant there. I'm going to shower anyway. So I'm just going to turn it to cold. I'm going to eat breakfast anyway, so I make sure it's a good quality breakfast that fuels me for the day. I get a little bit of a dopamine release and a serotonin release. Is it with just having a cuddle with my son, playing with my son?
Yeah.
So it's just kind of basic thing. Sunlight, just because it kickstarts my help me out, Emma.
Your metabolism, your circadian rhythm,
rhythm. Thank you.
Absolutely.
So again, I do think it's about stacking those little wins.
And I think you've really hit the nail on the head there. If you can do the little things consistently, then the big things fall into place. I really do say to my patients, let's just start and be really consistent with one meal and get that one meal right. Because again, I'm thinking, my outcomes are bowel habits and things like that. And I'm like, look, let's get breakfast right. Let's get your oats in. Let's get your fiber in. Let's get your fruit in. Because if that works and you feel better for having it and do that really well for 2 weeks, that's a really small thing that you can do. Because if it works after 2 weeks, you're more likely to sustain it. So I, when I'm thinking about goals for my patients, I'm thinking go small, just really small, but get that bit right. And then hopefully the rest of it will start to fall into place. And I think you're totally right with those serotonin hits, those endorphin boosts. And also it depends on what type of person you are. For you, it sounds like, you like your routines and, you've done these bits and that works for you. And you probably get a lot of satisfaction knowing that you've done it. And that then probably contributes to your overall well-being.
Absolutely. Momentum builds momentum.
Yeah. But again, you've got... everyone's priorities are different. Everyone's home setup are different. Everyone's financials are different. Some people don't have the time to do any of that. Some people are out the door before their kids have even woken up because that's what their job is. So yeah, and I think it's them thinking, right, where can we advise you around that? Actually, if you know you're going to be out the door before you get that hug with your son, can we make sure that you prioritize that time at the weekend so that those weekend hours are really sacred? And I think that's where it's that, that really balanced view, and I think there's a big thing with children. I think personally, and I know this is sort of very much what a lot of the advice is for kids, try and eat with your kids so that the kids can see you eating normally, and trying to get them to understand the importance of balanced eating, and that sweets are not a reward. Sweets are something that we can have, but you don't get as a reward, and really start those good eating habits early so that you can then as a parent know, right, okay, they at least understand how to prepare these foods and all of that. Like my niece and nephew over Christmas, we got them a little kids chopping set, so that it was like one of those safe kids knives kits. I don't know how safe a kid's knife is really, but under full supervision of my sister-in-law. But they love helping with the cooking, and I find they just love watching cook. And even the 3.5-year-old, he has been fascinated by cooking from the start, and I was like, look, you just need to get them as involved as possible. And she's so good at letting them choose their meals and really helping them to regulate themselves. And I think having that really good attitude to food at home goes a hell of a long way for helping kids. I know that's a very different tangent to what we've been talking about, but I just think if you can get things right at home, and actually for a lot of parents, if your motivation is to get my diet better, I need to set an example for my kids, and actually their kids are always going to be a really big motivating factor for them. I always say, look, see this as your kids need to see you eating well. You need to be doing this with them. And actually I find that's a really good motivator sometimes for people. Sit down with your kids, show them it's good to eat these fruits and vegetables and these balanced meals, and then it's also okay to have that pizza. It's okay to have some sweets, but also we need to eat well the rest of the time. I think that is the kind of thing that really sets people up for those really good long-term changes. It's lifestyle changes. It's about all of it together, not just what is actually on your plate. It's the surroundings. Have you stepped away from your desk? Have you stepped away from that screen? Are you watching videos whilst you're eating? And also another one is eating with a knife and fork rather than just a fork, and just shoveling in, taking time to eat. Little things like that can make a huge difference to your whole attitude to food. If you don't prioritize meal times, it's always going to be a low priority the rest of your diet. You're not even prioritizing eating the food sacredly. So how are you going to prioritize the rest of the meal plan if the meal itself is the least of your worries? So yeah, that's
really interesting, because that's something my wife in particular is very big on us eating as a family. And it's quality time. There's no screens. But also on the point of setting an example for your kids, and it's difficult. As soon as people become parents, they become quite preachy, and I'm conscious that my son's 13 months, so I'm not an experienced parent yet in that regard. But people say things to me like, oh, let him have a little bit of birthday cake, or let him have a little bit of chocolate, and we're sort of saying he's one. He doesn't need birthday cake and chocolate yet. He can, and we're not going to be that parent or those parents. He can have the cake, and he can go to his friends and have not a problem. But he's one. Give him a peach and watch his face light up. He's like a junkie. You give him a peach or a bit of mango. If you've never had mango before, how good is that?
I'm not going to lie. I'd rather have mango than birthday cake.
Right.
Not all cakes are that great.
I agree.
Particularly chocolate birthday cake. Give me a mango any day.
Yeah, and you can see it.
Yeah, I know.
And again, yes, you can have it in time. It's not a problem. But let's let him get out the blocks a little bit with it.
Yeah, no, absolutely. And I think with kids, sometimes it is allowing them to taste these things without giving them the whole portion of it. And yeah, like you say, sometimes fruit is the preferable option. And yeah, I think it's like you say, it's very easy to be preachy with a parent. There's a lot of judgment around parents these days, and gosh, it's interesting when you see some of these Facebook groups and Facebook forums, and you just these keyboard warriors going, "You can't do that to your child." It's a bit scary, and I think they're as long as that child is healthy, happy, and fed and secure, then I think that is, those are the main things that I would always say to any parent that's worried. But yeah, eating together, and I think it's those good eating habits in general as a family. And I think if you can get it right at the dinner table at home, and you appreciate how important it is to have that time to eat, then maybe that helps you to do it at lunch at the office and at breakfast, not just having it in a cereal bar in the car on the way in. You get up 15 minutes earlier to make sure you've eaten at the table before you go. It's little things like that. And I think, get it right for one meal and hopefully it translates to the rest of it.
Yeah, I absolutely agree. And I've always been a fitness enthusiast and a health enthusiast anyway, but now more than ever, I want to be I'm an old school, I don't want to say alpha male because that makes me sound like a bit of a knob, but I'm a type A personality. I'm a red, whatever the profile is. I like fighting. That's my hobby. I like manly stuff. So I want to be the protector. I want to be the role model. I want to be the guy that he looks up to, and sets the standards. And so I'm sure I'm not alone in that. I know a bunch of dads at the gym that also feel that way. And being a role model for your kids is a wonderful thing. My dad's my hero. I'll tell you a very quick story and then we'll move on from the parenting thing because we're going off on a tangent. But we didn't have a whole ton of money when I was growing up, but our house was too small for us. But my parents didn't have the money to move. So my dad, who by the way works in finance, built another story on top of the house himself, built a loft conversion himself. And that's the type of stuff that I can't do. That I'm terrible. I can't even hang a shelf. I didn't hang these. But it's being that dad or that mum where they look up to and say, my dad does, or my mum can, or I think that's super important. And I think it starts with the basics.
Oh, hugely. And we are such products of our parents and their work ethic. And my granddad was a head teacher and he always said, education is the key to everything. And I was like, yeah, do you know what it is? Just always keep on learning, always keep on trying to better yourself, always keep trying to push yourself so that you're pushing yourself into new realms and you can get more information. And I think for me, I always like to try to be the person that when those patients come to me, their interaction with me is hopefully giving them something to add to their education and their knowledge of food and nutrition. So I think we've all got a role to play in not only our own lives and bettering ourselves, but contributing to other people. When you're in a position where you have a qualification that can help people, I always try and make sure that we're giving the best quality advice as we can. And actually, I'm the first person to go, do you know what? That's not my area of expertise. I would not feel comfortable trying to give advice on that. I'm just waffling my way through, diabetes advice. If that's not something that I feel comfortable giving, I would say, actually, I'll give you the basic advice and then I'm going to refer you on. And I think having that accountability as a healthcare practitioner is probably the most important thing. It's when you've got people that are confident but not competent that you've really got to worry. And I think that's probably where the social media element is very, very glaring at the moment. There's a lot of very confident people with not a lot of professional competence. And
a little bit of knowledge is a dangerous thing, I think is the saying.
I think so. And I think when there's a lot of money involved and people are doing paid posts, they'll say anything. And also people just hand people scripts these days on these social media posts. And it's a scary world. And I cannot explain my frustration of when these patients make it to me after I'm paying hundreds of pounds for some of these testings. And you're like, oh gosh, it hasn't helped you at all. It shows you how false a lot of it is. So I think my advice for anybody that is struggling with any kind of health problem is go to your GP, make sure you've had all the right testing done to rule out anything more sinister, and ask for a referral to a specialist dietitian. If there isn't one in your area, you could request perhaps to go to a different area, perhaps some of the bigger cities that do have perhaps slightly larger hospitals and dietetic trusts. And if not, there's some fantastic online resources as well for nutrition advice. It doesn't just have to be nutrition advice. You can go and see dietitians for pretty much anything these days. And there's a really fantastic list of private dietitians that you can find. If you just do a quick Google private dietitians, there's like a list of them on there. So it is one of these things where don't feel that you have to just muddle through on your own. A lot of what I do is sense checking what other people have read and listened to in podcasts. And, unfortunately, there's a few professors out there that like to give out advice, and it's really been quite damaging for a lot of people. So, we're having to really myth bust a lot these days. So,
On that, a couple of things, Emma, just before you go. I'm conscious your time is valuable. I don't want to keep you here all day, although I could.
I could talk about it all day.
Well, it's clear that the passion is really coming through, and so is the knowledge. I think this is going to go down really well. I think it's going to help a lot of people. But I've seen a bit of a U-turn recently on social media. So maybe you can help me with this.
Yeah.
On the benefits of fasting. Is it just not eating? I mean, we know that's what it is in its description, but in terms of what it actually does.
Yeah, absolutely. I think it's to be honest, it could be its own podcast, and this is a really tricky topic, I think, to cover. You can use fasting. Fasting is something that you can do for different time periods, and you may get different outcomes. You've also then got to think, what is the purpose of my fasting? Do I have any medical conditions that this is going to benefit? What is the evidence for fasting? Some people actually are put on very specific low-calorie diets with fasting elements in there to manage things like type 2 diabetes and actually reduce their risk of type 2 diabetes from worsening. Right. There's a lot of studies on that, and there's really clear clinical outcomes in terms of, weight, you think like your BMI, your waist circumference, your blood tests for your diabetes markers. So for those kind of conditions where there are studies on it, absolutely. I think that's something that with the right guidance that can really, really benefit you. But say you don't have type 2 diabetes and you're not overweight, what are you trying to get out of it? Because yes, there are some people that say, yeah, this really helps my energy levels. This really helps to reset my sleeping and things like that. I'm sleeping better. But how long are you going to do this for? Because realistically, we don't always know the long-term consequences of continued fasting. So it's a pretty loaded question because there's so many different answers. If you were to ask me about fasting to help reduce the risk of diabetes and cardiovascular disease and non-alcoholic fatty liver disease, absolutely. There's studies on that. There's very clear outcomes on that. Yes, the studies aren't always necessarily the best quality ones. And those kind of studies are always done on patients with high BMIs who have weight to lose, who are then naturally probably going to lose weight because they're in a calorie deficit. So those are really clear outcomes. But if you're not in that kind of category, you've really got to be thinking, why am I doing this? For some patients, they found it helpful to have fasting windows. So actually, they're only allowed to eat for maybe 8 hours of the day. That might just help with calorie control and portion control and things like that. So those are the kind of perhaps lower risk ones that I think can be really helpful. But again, I'm an evidence-based dietitian. I can't be saying, yeah, absolutely go off and do fasting. It's not something that I would be recommending. But what I can say is it's unlikely to cause you harm if you're doing it for a short period of time. But please be mindful that if you start to feel unwell at any point, it's probably not the right thing to carry on with. So it is a really tricky one to answer. And I wouldn't be recommending any sort of fasting blindly to anybody without understanding what the purpose of it is. So I'm sorry, I can't give you an exact answer.
No,
but I just
I think that is the exact answer. But I think in a roundabout way, that is an exact answer.
Yeah.
Is that it's not just, don't just follow X influencers' advice.
No. And don't even get me started on juice cleansing. It's in a kind of similar category. It's been promoted as to be fair, an easy thing to do. It's easy to not eat and be conscious that you're not eating. So I think for a lot of people, it can just be, oh, good, I'm doing really well, I'm fasting. And don't forget, with a lot of weight loss techniques, you lose a lot of weight initially because you lose a lot of fluid because of just how your metabolism shifts. So you lose a lot of weight initially, but then you carry on your normal routine and habits, and then you regain the weight anyway. So I think you do have to really be thinking, if I'm doing fasting, what am I doing it for? How am I going to change what I'm doing beyond the initial fasting period to then have the benefits that I want? But honestly, I could do a whole thing on fast, a whole hour alone, or a whole day on fasting. It's not a quick answer. And I think if you are considering doing it, make sure you do your research, do reach out to specialists that, can support you with it, and really think about what your goals are. Are there other ways to reach those goals without starving yourself? Because ultimately, if you're miserable, that's not going to help anyway.
That's a great point. You talked about juice cleanses. Let's do a quick whistle-stop tour of, I guess, foods with slogans. It's one of my bugbears. Low fat, low carb, extra protein, or just anything that just has the word protein slapped somewhere on the packaging.
Yeah, absolutely. And I think some of them absolutely have a place. And I think high protein yogurts in particular has been something that I see a lot of people having now because there's just an easy swap, isn't it, for a breakfast or a snack or something like that. So I think some of the high protein products are really helpful, particularly when you are trying to get in that protein and you don't want to be doing all the protein shakes. And absolutely. But what you do have to remember with any of these products, whether it's low fat, low sugar, high protein, they do kind of come under that processed food umbrella. So you've got to then be thinking, right, am I benefiting from the fact that it's low fat, but then it's probably got higher sugar in to counteract the fact that there's low fat in it? And equally, if it's then classed as low sugar, it's probably got fat in it to bulk it out. So sometimes the low fat, low sugar ones, you end up pretty much doing a swap with. But because it's advertised as low sugar, you're like, oh, that's healthy for me.
Yeah.
You also, again, got to think of the emulsifiers added into it to stabilize it if there's no fat in it. And same with sugar. What are they sweetening it with? They're sweetening it with artificial sweeteners. For me, I'm a little bit like, if I'm then having something artificial, is there really the benefit of then choosing that product? I would say I very rarely choose the low fat or low sugar, very rarely low sugar, because I think that I don't like the taste of artificial sweetener. But certainly for low fat and fat free, I think fat free Greek yogurt tends to be a little bit more balanced. But again, you can go to a supermarket and buy the supermarket own brand versus the branded product. Both say fat free or low sugar. Look on the back, the ingredients could be completely different, and one of them actually may be a little bit more natural and they've just removed the fat, and some of them may have loads of emulsifiers and additives in. So I would say, very similar to what we said earlier, not all of these products are born equally and made equally. So sometimes it is a bit of a balance. I just think if you are relying on that low calorie, low fat, low sugar Weight Watchers yogurt, and that's the thing that you're really worried about, that again is potentially the problem, because actually you could probably have a normal yogurt with some fruit in and have a better balance of a meal than just focusing on that low fat, low calorie yogurt. I just think if you this is very much coming back to my point of, if you overcomplicate it, I think it makes it worse. So I think they have a place, same way that, skimmed milk has a place. Lower fat might be better for people with, again, like diabetes problems. But again, there's less fat in there to slow down the absorption of the sugar, which then can have an impact on your glycemic index and your sugars and all of that. So again, it's not just a simple answer, because we don't know how your body's going to respond to that product. And equally, if you've had a fat-free yogurt, but then you've had pizza the night before, what's the point? I just think you can, again, overcomplicate it completely. And there's literally no point in doing low fat this if you're just going to go and have a big load of cheese on something else. It just, you do have to really take it all with a pinch of salt and go, why am I doing this? Is this completely necessary? Do I have health needs that absolutely need this? Or do I just need to go back to basics and get it all right in the first place?
Love it. Just to close us out, could you maybe give us 3 or 4 headlines, bullet points, that if someone wanted to make a change perhaps, or wanted to just, again, I don't like terms like this, but tidy up or clean up their diet, or maybe just feel better, just some real basic starting points that you would advise?
Absolutely. I would say we are people that need structure and routine, and I think if you can do yourself a meal plan, do it, just a really simple thing. You buy them off Amazon, those sort of magnetic meal plan boards with whiteboards. I'd always recommend getting a meal planner, because if you're having a kind of week where you are really stressed, you're busy, you're overwhelmed, and you've not even thought about what you're going to have, you are more likely to then go to the cupboard and get something unhealthy, or go on that app and deliver that takeaway. If you've got something prepped and planned and you've got a rough idea of what you're going to have, you are more likely to eat that healthier food. And that's the same for snacks. It's a case of, if you buy the crisps and the chocolate and Haribos, you're going to eat them. So plan to buy other things that you can swap. And I think the more planning you can do in your week, the better. So that would absolutely be my one place to start. Sometimes it's also quite good as a bit of an aid to visualize what you're eating. If you write down what you're eating, you can see it and you go, oh my God, I ate that today. That's terrible. And I've eaten that every day for the last week. You can kind of almost see yourself and what you're doing, whereas if you don't write it down, you can't always see it. So I think having those really good visuals is really helpful. I would say processed food wise, I would say try and limit your ultra processed foods, and that's stuff that has got so many ingredients in that you wouldn't even be able to know what they were. And ultimately, if they're not in your kitchen cupboard, should you really be eating them? If they're not something you can make your own food with, really do question it. But also things like bread, baked beans, they're classed as processed foods, but it doesn't mean we're not going to tell you to eat them. It's the ultra processed foods, the stuff that's got loads of emulsifiers and additives in, and just those sugar-free, fat-free things. Those are the kind of things that we know now are going to be potentially more detrimental to sort of long-term health. So those are the kind of things I'd say try and veer away from them, because actually overall that's going to help your gut health. It's going to help how your body functions with less of those processed foods in. So that'll probably be my next take home. I think my last bit would be, it's not just about the diet. if you don't get the sleep right, if you don't get the stress right, if you don't get the routine right, if you don't have that really holistic approach to how you should be looking at this, then that is the problem. And diet can go a long way, but there's so many other things to it. So yeah, get the diet right, but really make sure that you're looking at all the other bits as well, because we are one person. You know, and again, this is very much like what Adam does with all of his, you know, his treatments. If your neck's hurting, is it your lower back that's the problem? Whereas if you just rub your neck and the lower back's still the pain, you know, it's about making sure that you're looking at the cause and effect, not just where the symptoms are. And I think that's very much how I approach any advice for anyone that I see.
Love it. This has by far been one of my favorite podcasts so far. Emma, thank you so much for making the time. Where can people find you?
So what we'll do is we'll be getting our website and Instagram accounts available. So we'll make sure that you can click on the links there. But we're going to be sort of operating virtually initially, just because it's a lot easier, and we've got a lot of patients that are really preferring to be seen virtually. So yeah, we'll make sure that all the links are available to get you to be able to book in.
Would a good place to start be LinkedIn?
Yeah, so probably we're sort of more social media and website based, really. So yeah, probably there. And yeah, LinkedIn is always an option professionally if there's any NHS work. But yeah, more for the private stuff, it would be more Instagram and our website. So we'll make sure that they're all linked in the bio and the comments.
Lovely stuff. I've enjoyed this, Emma. Thanks again.
No, thank you so much. It's been great to talk.
Pleasure's mine.